Wait, don't go nowhere. Somebody asked a question and I'm about to answer it. So don't go nowhere. Stay here. All right, let's go. Hello, family. How are you doing? I'm so excited. Welcome, welcome. Let's get it right. So this is a 15-minute live Q&A with your CEO three times, the real Alisa Applewhite, right? CEO three times. I said that. Y'all know I'm in the background doing something. All right, yo. So let's go, right? So this is episode 101. Stay tuned and we're going to get to it. I already put the clock on. So let's go to the banners. All right. Why do I go live Monday through Friday? Anybody who's been following me for 101 days? Why do I go live Monday through Friday? All right. So I go live Monday through Friday because people keep DMing me, emailing me, texting me, and calling me. And I want to say, shout out to the Facebook people. I literally got 10 Facebook friends last night. I don't know what video's going around, but shout out to the Facebook people. I appreciate you. I'm going to check ClickFunnels for sure to see what came through because I didn't check last night to see what came through. But shout out to the Facebook people because I literally got 10 requests last night alone. So they are truly, truly growing. All right. So keep asking me questions. People ask me questions about business. They ask me questions about life. Hello, Instagram family looking below. They ask me questions about life. They ask me questions about marriage. Y'all, look, I don't have the time to answer everybody's question, but what I can do is take one question at a time and answer it for 15 minutes. And I give you 3 points on what I think the answer to the question is. All right. So this is why we go live Monday through Friday here every day at 12 o'clock, or you can catch us Saturdays and Sundays, and you can catch us Saturdays and Sundays at 12 o'clock. So those are the recordings, but this one is the live. All right. So keep asking your questions, y'all. The next thing, people always say, why do they call you CEO three times? So they call us CEO three times because we got three companies. Simple. But I had to realize, like, this is bigger than just three companies, y'all. I'm a CEO and my boss. I'm a CEO in my life. Like, I'm a CEO of myself. I lead myself. I'm a CEO of my children in my community, right? I'm making strides to help my community, and I'm investing in my kids. And then I am a CEO at the job or at this business, whatever I'm doing. I'm bossing it, right? Especially at these three companies. But that's what it is. It is CEO three companies, y'all. The first company we have is called Top of the Line Healthcare Staffing, where we staff medical professionals in hospitals, doctors' offices, and nursing homes. Then we have TOTLHS Heart of Gold Inc. This is our nonprofit. This is our baby that takes care of our medical professionals. By holistically taking care of the medical professional, they can holistically take care of the patient. Company number 3, the real Alisa Applewhite Consulting, and that has brought you questions live for 15 minutes with your CEO three times, the real Alisa Applewhite, which is me. We don't only do that, but we have a podcast called Beyond the Scrubs Podcast, where we literally take everyday people like you, sit down with you, talk to you about what's going on, what type of patient experience you had, or what type of medical experience you had as a medical professional, right? We want people to understand that healthcare is just a different type of beast. So we want to bring that out with healthcare. All right. So we also have where we teach everyday people like you how to build a healthcare staffing agency from ground to government. We also teach people like you how to build a healthcare staffing agency, period. And then we partner with hospitals and doctors' offices and nursing homes to show them on how to retain their staff. And that is a consultation hire. So we're doing so much in this agency. How can I forget? We have now partnered with schools where we go out to the schools and we talk to youth in the schools. So we have a program for youth where we can target youth and help them learn how to build a business before they get out of high school. All right. So here we go. That's a lot. But that's what it is. 3 companies. All right. So let's get to it. What episode? What episode? Oh my God. 101. 101. Ooh, 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 ooh. 101. All right. So episode number 101. Why do nursing homes hire staffing agencies? This is a great question. And I just for clarity, I just want people to know that this question will be answered for healthcare staffing agencies. I do own a healthcare staffing agency. I just told y'all, top of the line is up here, one there, top of the line. There you go, top of the line. Top of the line. Wait, top of the line. There we go. Top. Right there. Wait. Go in. Go in. Look at the camera right there. They almost got my finger. Top of the line. All right, so top of the line. Look around. The logo's all around me. So literally, I do own a healthcare staffing agency. So this is going to be answered as a healthcare staffing owner. All right. So why do nursing homes hire staffing agencies? I give you 3 things on why I think nursing homes hire staffing agencies. Now, there can be multiple, but I'm only giving you 3. All right. So the first one, nursing homes need staff now. Like y'all, I don't know if y'all know, but a lot of medical professionals left the nursing home and job career altogether. So they are extremely short in medical professionals, and a lot of them went traveling, and not only just traveling, but to the hospitals traveling. Some of them did other jobs because at the time that all of this stuff happened, when the pandemic happened, you would easily get a CNA that was making like $7 or $8 an hour, right? And it's just like, for all of this, I can go to McDonald's and make $10 or $15 an hour. I don't have to deal with this, including the potential of death for myself and my family and my kids. So when it came to nursing homes, a lot of their staff had exited right after COVID and during COVID because of the exposure and because of the lack of pay. And them saying pretty much, I love patients, but at the end of the day, am I really willing to risk my life for $8 to $9 an hour or $10 an hour? So no, I just rather go get a job somewhere else. So you lost a lot of people in a nursing home. So this is one of the reasons why they hire staffing agencies, because they have a certain number they have to keep in order to stay legal and open. So they actually need staff now. And I always advise people, if you are starting a healthcare staffing agency, nursing homes should be your first target. And they should be your first target because nursing homes normally do in-house paying. So that just means that they pay you directly from the administrator or the corporate company that they're working with, depending on the nursing home. So you don't have to wait for Medicare and Medicaid. Y'all know how I feel about that. I'm not on that level yet where I am waiting for Medicare and Medicaid, but I will be along the lines. But right now, I just like the money directly from the person. Like, I give you the service, you pay me directly, right? So the second thing is, why do nursing homes hire staffing agencies? All right. So nursing home staff become burnt out. So this is so true, right? You got to look at the type of work that medical professionals do in every facility that you decide to put them in. And this is what I love about being a CNA for 6 years, being an LPN for, I believe, 4 or 5 years, and then being a registered nurse for the remainder of the years, right? Because I worked in over 50 something facilities, because I worked in 3 different positions, because I worked 48 hours to 65 hours a week, or 72. I have gained a lot of inside knowledge. And that's what makes me, I know. That's what makes me a bomb mentor, because I know the ins and outs of hospitals. I know the ins and outs of mental facilities. I know the ins and outs of nursing homes, right? I always tell people I had multiple jobs. I never had one job. So because I learned the ins and outs of what goes on and what's expected, this is how I know, okay, if I train my staff to do this, then they won't get burnt out on that and they're more likely to stay. If I do a contract for this amount of time, then I know that this is less likely, according to research and according to me being there, according to listening to all these 20 years of experience from other nurses complain about the same issues, all of that research, and saying, all right, so this will work short term for this facility, right? So how do I staff this facility? So they literally get burnt out, y'all. In nursing homes, CNAs have to give baths, right? I'm giving y'all some inside game in here. Take it and utilize it how you want to, but believe me, I'm giving you a little bit of research. CNAs have to take the patient's baths. And I'm talking about they can have anywhere from, in the morning time, 10 to 15 patients in the morning. That's 10 to 15 people that they got to bath. They got to change every 2 hours. They got to brush their teeth, find their teeth, get them dressed, get them in a wheelchair. After getting them in a wheelchair, go take them to physical therapy. After they go to physical therapy, then they got to get ready to eat. So now you got to not only feed the people that can't feed themselves, but you got to monitor the people that might choke. And not only do you got to monitor the people who might choke, but what about the people that need to be changed during the time that you're supposed to be feeding, right? And then let's not forget about the nourishments, because now we're going to snack time. And then you got to find everybody and give them nourishments. And there's certain people you got to give nourishments to because they can't feed themselves. And then you got to watch the ones that could potentially choke so they won't hurt themselves. What about the right medications, right? As a LPN, as a RN, the people in the nursing home, they know their medications, and they say to you, this blue pill I've never taken before. Now you got to go and look and see, what about the medications, what is not right, what is changed, explain that to the patient, explain that to the family, get some type of explanation from the doctor. And still, as a nurse, as a good nurse, you change your patients, right? When I mean changing, I mean these grown people that's having bowel movements and peeing on themselves. We're there and we're changing them, right? Regardless of what it looks like or what it smells like or what's going on, we are there because we are servants from God, right? So you not only get to do all of that as a nurse, but let's not forget, you got to document. Let's not forget, in a nursing home, you got to do the Mars every 30 days. And you got to do it before the 30 days is done. And some nursing homes, they still in paper Mars. They not even digital Mars. So you got to look at it and make sure that Mars matches the next medication, last month's Mars that they had, to make sure no medication fell off. And if a medication fell off, then what should I do next as a medical professional, right? If you have a patient to fall, then when that patient falls, as a nurse, you have to do an assessment on that patient. Not only do you got to do assessment, but now you got to call the family, you got to call the doctor, or if the family's not the guardian, you call the guardian. And then you got to call the doctor to let them know this person now has to be on what we call fall precautions, where now you have to literally monitor them. I think it's every 15 minutes times 4, every hour times 4, and then every 4 hours, or based on protocol, right? So these are people that you have to make sure you physically look at. Hey, are you okay? Do you need anything? You're watching for signs of bleeding. You're watching for signs of fractures. You're watching for signs of wounds, right? So you got to do all of that in a nursing home. And then they say, oh, don't forget about the showers. When you got to put the patients in the shower bed and take them to get a shower, that's a whole different thing. And what about the activities, right? For the patients that love to go to bingo, you got to take them to bingo, right? You have to do all of that. And most of the time you got to do it without equipment. So you're hurting your back, you're straining your back. Some patients are dead weight and they can't move at all for you. So you find yourself with somebody else, hopefully, which should be legally. You find yourself hurting your back because you're trying to get work done, because just like you got 15 people, that other CNA on that hall got 15 people. And let's not forget night shift. Night shift, they will literally sit a CNA with 40 patients. I'm just saying, I'm being honest, because they figure, hey, you don't have all activities, all you're doing is changing. But there's nobody who can successfully change 40 patients every 2 hours. So this is why you get your increase in bed sores and wounds. So what I'm saying to you, y'all, nursing home work, it ain't easy. It's hard. So take all of that and utilize it as research to find out the problems that your people are having with staff in nursing homes, and you can potentially get a nursing home contract. All right, so number 3. Episode 101, why do nursing homes hire staffing agencies? We got 1 minute left. Nursing homes can't be understaffed by law. So this is very important, and you need to know this. No matter what state you live in, there is a law that says if you are a nursing home taking care of elderly people and receiving money for your services, your numbers for your staff cannot fall below this. If you are a nursing home and you have license to receive Medicare and Medicaid from the government, you must have at least one registered nurse in the building or access to one registered nurse, right? So you need to know your rules for having a nursing home. This is research that you need to do in order to staff a nursing home appropriately, right? So they can't be understaffed by law. And if you look up your law, like the Department of Health and Human Services for North Carolina, for Texas, for Alabama, right? If you look up those laws, it will not only give you a list of how many staff can legally be in the building or you can operate with, it'll give you a list of all of the nursing homes in the area of the state that you're looking for. So I just gave y'all two goals right there. So I'm not going to repeat that. You want to hear it? Play it back again. Love y'all. All right, so let's go over all 3. Why do nursing homes hire staffing agencies? 1, nursing homes need staff now. 2, nursing home staff become burnt out. And 3, nursing homes can't be understaffed by law. All right, y'all. So as I always tell y'all, make sure y'all following me on all social media platforms at The Real Alisa Applewhite. Again, that is The Real Alisa Applewhite. Follow me on all social media platforms. Y'all go to YouTube right now and hit subscribe. If you aren't my YouTube friend at this point, after 101 lives, I'm just going to have to do 100 more just to get you. So make sure you go ahead and you subscribe to the YouTube channel now, right now, not tomorrow, but right now, okay? Go subscribe. Y'all, we got a course. I keep bringing this up. It's called Make the Call to Get the Client course. Literally, we are teaching people how to build a healthcare staffing agency from scratch. And this course is filling up. And today, thank you to Marcus Rozier. I think I'm saying his name right. He came into Morning Meetup, and I keep telling y'all need to join Morning Meetup. Stop playing. He came into Morning Meetup today. He's a very educated mentor and wealthy mentor. And he literally gave me insight on, I have over 70 clients. Okay? Listen to what I'm saying to y'all. I have over 70 clients. Why would I take out my time to help teach other people how to build a healthcare staffing agency when I know I can get $1 million from each client? Meaning I can get $70 million in a year for just servicing 70 clients. I have over 70 clients. So what I'm saying to you is, this is truly something that I'm doing to help people. It's not a money thing for me. I really want to see you succeed. I really want to push you to your success. My team wants to see you succeed. My team wants to see your success. But next year, y'all, I don't even know if consulting on this level is going to be an option, because it doesn't outweigh the risk. I can literally take $70 million and build everything that I need to build so you can have somebody to consult you. Now, will you get me? No, probably not, because I'll be working on other ventures, because I will make this company $1 billion company, period. It's not even a thought, right? It's not even a thought. So when he said that, when he said what he said, and that's how I received that, was like God did an overflow like he promised. I've only been in this industry for 3 years, and I have 70 plus clients. And the way I target my clients, I literally can tap out $1 million out of each client, because that's the way I target them. And what I'm saying to y'all is, when he said that, it just resonated with me like, and you're doing teaching because, oh, there you go. that heart of yours is like giving so much. But what I'm telling you is we're going to give you in December. You're going to learn how to do this healthcare staffing agency. You're going to learn how to get a client. We're going to push you through this thing. We're going to push you through, like I always say, pray you through. But we're going to push you through this thing. So don't pass this offer, because I will never offer it at this price again, even if I offer it next year, just based on those little facts that I have. All right, y'all? I don't want you to miss this opportunity. All right, so we have it's 75% off. Where we go? November. Oh, we're going here. All right, so it's 75% off. All right, so it's a Black Friday sale, 75% off. All you got to do is DM the word course. If you DM the word course, we will get on a call with each other and you can determine if this is for you or not, right? I want to meet the people that's going to take the course. That's why I'm just not giving you the link. So if you just DM the word course on any social media platform you're on, we will reach out. My team will reach out and get you on the calendar, okay? So you don't miss out on this opportunity, because I am going to focus on top of the line next year to liquidate that 70 plus million dollars so we can be where we need to be, right? All right, so for those people who want to build a healthcare staffing agency for free, cannot stress this enough, this is free. November 24th, which is this Friday at 8 p.m. Make sure you join me for the webinar, right? So this Friday at 8 p.m., make sure you join me for the webinar, and you will literally get the game. It won't be filtered at all, where you will come out building a healthcare staffing agency. All right, y'all. So I always end it with I absolutely love you. I adore you. I'm so glad that you are here with me today. I'm so glad that you chose to be here with me today. You could have been anywhere in the world, but you woke up and you said, I want to see Alisa. I'm going to listen to Alisa today. So I'm trying to tell you, if nobody told you today, I love you. I love you. I love you. I love you. But I promise you, y'all, I promise you, nobody loves you like your creator. Nobody loves you like God. Nobody protects you like God. Not your mama, not your husband, not your kids, not your dog, not your spouse. Listen to what I'm telling you. If you build a relationship with God today, if you take it serious in your life and you say, God, here I am. I don't know what to do, but start working on me, please. I'm just going to talk to you every day, and I'm going to talk to you every day like I'm talking to Alisa, right? Start building your relationship with your creator, because those storms going to come, whether you like it or not. The question is, are you going to be prepared? That's the question. Are you going to be prepared? Because with your creator, and when your mind is always on your creator, you're always prepared, right? When you are in tune with God, you're always prepared for when the devil's coming, because he's going to come. He's going to come. Not you, not me, not nobody could stop it. He's going to come. And guess what he like to do? He like to creep in your mind, have you thinking stuff you shouldn't even be thinking. And one thing Myron Golden said that I absolutely love is, if you think about something and it's a sin, that ain't God talking to you, period. God don't work in sin. So that's how you discern the voice of the devil and God. If you get a thought, it has nothing to do with God, and it's a sin in that thought, it has nothing to do with God. But I'm telling you, you can't even get that far if you don't even know who your creator is, period. Right? You can't even get that far. So tune in, y'all. Build your relationship with God. We got some heart to it. Hey, boo, I ain't see you in so long. Y'all, this is Lisa Gooding. She has her own staffing agency. She is my sister. We literally built our staffing agency together. I'm just saying, Lisa was on vacation for a long time, and then she came back. She started killing, right? So I absolutely love you. Thank you so much for coming to see my live. That really made my day. This is what we do. We build staffing agencies and we stay in each other's lives just in case something else happens, but not just in case something else happens, just to build a relationship. Because once you start making a certain amount of money, you need different friends for different things, right? You ain't got to get rid of the old ones, but you will see the conversation will change naturally, right? So go out, y'all. Go build this relationship with your creator. I'm so glad y'all here. Like, y'all don't know. Y'all be making my day. Thank you for being here, and thank you for trusting me and believing me. All right, so now let's go. Oh, y'all gotta buy a book. Let's get it. Here you go. Buy a book. It's your girl, Alisa Applewhite, the real Alisa Applewhite, your CEO 3 times. And y'all, look, we are taking this challenge. We are having a challenge, right? This challenge is called Make the Call to Get the Client. Again, that's Make the Call to Get the Client. And in this challenge, I show you how I targeted premium clients and how in less than 2 years, we created 7 figures in our business. So people always say, you say 7 figures, how much did you create? So in less than 2 years, we created over $5 million of revenue in our business by using these principles and methods. So I advise you to go ahead and take this challenge. So this challenge is for business owners that want to learn how to target premium clients. It is specifically for healthcare staffing owners that want to know how to target healthcare staffing clients. But there is principles and methods in this challenge that general business owners can use to target clients in their arena. Look, y'all, I have been practicing these skills. I've been in healthcare for about 18 years now. And one thing I know how to do is target a premium client. So I want you to come on and target these clients with me. Why? Because if you have a healthcare staffing agency or you have a business and no matter what you're doing, you're unable to get clients, then this challenge is for you, right? I want you to be able to live out your dreams and your goals. I want you to be able to help your community. I want you to be able to help your family based on the revenues and profits that you're bringing in, right? So the only how we can do that is we got to take the challenge. So make sure you click the link below and you register for the challenge today. I will definitely see you. If I don't see you, I'm going to call you for sure.